Toolbox Talks, Incident Management Program. The purpose of this video is to establish and facilitate a standard process for reporting, management, and follow-up safety incidents. All employees have responsibilities in the Incident Management Program. Managers' responsibilities include ensuring that the affected area is safe, ensuring that prompt investigation with corrective action is completed following an incident, follow up with affected employees daily when employee is on shift, ensuring that an incident report has been submitted in a timely fashion, ensure that proper, effective, and timely accident investigations have been completed, and making sure that all direct reports sustaining a work-related injury or illness promptly receive first aid and receive follow-up as needed. All other employees' responsibilities include properly reporting any work-related injury or illness. All injuries, no matter how small, shall be reported verbally to their leader immediately. Taking all responsible efforts to make an area safe which is affected by an injury or illness or safety incident to prevent injury to others. All employees shall verbally notify their immediate supervisor or work area management prior to seeking medical attention for all non-emergency work-related injuries or illnesses. Everyone needs to work with site management for all work-related injuries or illnesses through the end of healing. As needed, we should openly and actively participate in all incident investigation activities. All should ensure that details and information collected during the investigation are correct, and employees may request access to the provided information. Employees shall immediately inform area management of all scheduled work-related injury medical appointments, and they should provide all return to work or workers' compensation information immediately following a work-related medical visit. The procedure for incident management. Any employee of Wausau Supply Company must report any work-related injury to their immediate supervisor or manager as soon as feasible and under no circumstances later than the end of shift. This is to ensure that proper care is given and that any associated risk or hazard can be remediated to prevent reoccurrence. In the event of a medical emergency, call emergency medical services following the location-specific procedures. Clearly identify what the emergency is, whether emergency medical services are needed, even if precautionary, and the specific location of the affected person or persons. Transportation to a medical facility for medical emergencies should be via an ambulance. In the event of a non-emergency injury, any person sustaining a non-emergency work-related injury shall utilize any on-site first aid available, such as bandages, butterfly strips, or ice therapy, and use rest or elevation as needed. If any work-related injury becomes aggravated to the point where medical attention is necessary, the affected employee must notify their immediate member of management and human resources prior to seeking medical attention. In the event an employee is transferred to a medical facility for a work-related injury, their immediate supervisor or a member of management should ensure that return transportation is provided. If a work-related medical emergency has occurred, a member of management shall transport or meet the employee at the hospital. They need to make sure the hospital has the correct employer information. They need to request a completed return to work form when the employee is discharged. And they need to plan the employee return transportation as needed. In the event of a work-related emergency, the Director of Human Resources or the Safety and Environmental Manager shall notify the affected employee's emergency contact. For incident reporting and investigation, all work-related injuries and illnesses shall have a completed Wausau Supply Company Incident Reporting Form, also known as an FROI, completed within 24 hours of the incident occurrence. At minimum, the first 2 pages of the FROI must be completed within the mentioned timeframe. Page 3 can be done later, but recommended to be completed as soon as possible. And that page 2 is information received directly from the employee in their words. The injured employee's immediate manager is responsible for the completion of all sections of the FROI. This includes the individual is responsible for ensuring that the initial report as well as the full investigation has been completed. Complete all applicable incident investigations for work-related safety incidents within 7 days unless an exception is made by the Safety and Environmental Manager. When the incident investigation is completed, the injured employee's immediate manager shall schedule a review with their direct member of management and the Safety and Environmental Manager. And lastly, the entering, tracking, and managing of all corrective actions on the Incident Action Tracking Spreadsheet. The corrective action shall be placed in the action spreadsheet, which correlates to the incident area or business. Some self-care techniques that can be useful to all of us. The number one type of incident at Wausau Supply Company is strains and sprains. The good news is that strains and sprains are treatable through self-care with very few requiring medical attention. Wausau Supply will be there to help along the way by offering daily interactions with leadership following an injury or any needed materials to help in the healing process. The affected employee needs to practice patience. Do not continue to overexert a strain or sprain. The only cure for strains and sprains is time. And expect that day 2 will be worse than day 1. This is normal. Ice the strain or sprain early and often. Icing for 15 minutes every hour is recommended. Continue icing this way at work and home for 3 to 4 days. Heat is not recommended at all during this time frame. Wausau Supply can help facilitate time and ice as needed. So in review, what is the time frame after an injury or illness in which the incident reporting form must be completed? 24 hours. Page 3 can be done after, but recommended to be completed as soon as possible. Remember that many potential injuries can be prevented by taking the appropriate precautions and making sure we are following the company instructions and protocol.